There's not a whole lot of room, but we're gonna go in, we're gonna turn it and pull and see if we broke through enough. Hey guys, it's Dr. Carter here at Lexington Podiatry, and we have an unusual type rash on the lady's foot here. It's on the toe, it's on the bottom of the foot, and so my first thought is athlete's foot infection, but something just isn't right about it. So I'm gonna do a biopsy today. In the office, we normally do a punch biopsy, which is like a little cookie cutter. We take a little pinch of skin out and we send it to the lab. So we have to numb you up for that, of course, at first. So I use Marcaine with epinephrine, which is a medicine that kind of constricts the blood vessels so it doesn't bleed a lot, because who wants to have a big bloody site? And I need to see what I'm doing. So let's get started and numb her up. She's not allergic to any numbing medicines or epinephrine. I marked a few spots, and I think this is my best bet. This is the one that has some old lesions, some new lesions. She says this starts out as big blisters and they're extremely painful, so she's popped them, which is exactly what I would do as well, because you have to be able to walk. So we're gonna spray some cold stuff on here. It's gonna get really, really cold, hun. Super cold. I'm just gonna do a little poke right up under the skin. I don't need a whole lot. You're gonna see it raise a wheel, kind of like a TB skin test. There's a lot of pressure. Sorry, honey. There you go. Hopefully that's all we'll need. She'll get nice and numb and we'll be able to do the biopsy. So we'll be right back. All right, guys, we're back and we're gonna check and see if she's numb. So first thing I do is I'm gonna cover it with some betadine. Come on, Val. Scoot on up here if you don't mind. Let's get real close and personal. All right. She doesn't have any allergies to betadine. Always make sure we check that. Same thing with shellfish. You can have a cross-reactivity to that. I'm gonna pinch your skin. Do you feel that? Perfect. All right, this is our biopsy. It is a 3 millimeter punch or my cookie cutter. So we're gonna go in. There's not a whole lot of room, but we're gonna go in, we're gonna turn it and pull and see if we broke through enough. You try to be careful with the tissue and not destroy it like I'm trying to do now. We're gonna get a little bit of a blade because there's not a lot of tissue between the bone and the skin. That can make a difference. Let's see if I can get it. There we go. It's not a very big piece, but that's okay. Hopefully I don't need it. We're gonna send it in a container to the lab, and the lab will hopefully be able to tell us exactly what's going on. At least that's the goal. That looks perfect. I'm gonna throw my blade away and get some alcohol to clean her up. Don't want to leave her a mess going out of here. Perfect. She is a trooper though, so. The epinephrine really, really helps to make sure that it's not a bloody mess. If it's bleeding and oozing so much, sometimes you can't even see it, and that's not good for anyone. So a little bit of antibiotic on the gauze. Put it on there, and then we'll wrap it up with some Coban. We do it pretty tightly today just to make sure that, number one, it doesn't fall off by the time she gets home. And number two, to make sure it doesn't bleed everywhere. Nobody wants to get home and have a bloody soccer shoe. Perfect. And we'll do one final little touch. She's a cute little girl. We'll give her some eyelashes. There we go. All right, guys, that's how you do it. A punch biopsy for a weird rash. We'll see if we can't let you know what it is when we find out. Have a good day, and thanks for watching.